Williamson County. Let's walk into this with Commander John Gonzalez. John is the commander of clinical practice for Williamson County EMS in Texas. He's been with Williamson County EMS for the past 15 years, and prior to that was a clinical manager for the multi-specialty clinic in Austin, Texas. He served as a medic in the United States Army and holds a BA Associate's degree in the Emergency Management Administration from West Texas A&M University. Thanks for joining us, John.
Thank you, Chris, and thank you to AJ and Jim's for hosting this event. Before I get started, I'd like to give a shout out to our women and men of Williamson County EMS. They've been phenomenal during this entire event, especially with the rollout of Pulsara. They did a really good job at adapting to all the change. I'd also like to thank Captains Matt Biasotti and Captain Dan Cohen. They've been a huge help in rolling out Pulsara and working and making sure that this is a successful program for us. So a little bit about Williamson County EMS. We're located in Central Texas, just north and adjacent to the city of Austin in Travis County. We have a population of over 600,000 people, and we cover a geographic area of roughly 1,100 square miles. We have an annual call volume of approximately 30,000 calls per year, and we have 15 different first responder organizations that we work with in our county. We have 19 NICU-capable units running dual paramedic crews. We have 3 regional commanders of response Tahoes, and then we have 1 standalone response Tahoe in the far northwest corner of the county. As far as Pulsara goes, we introduced Pulsara about the 3rd week of March. We were originally set up under the Austin EMS MOC, Medical Operations Center, and quickly realized that we would probably need to expand its use of Pulsara, and so we decided to create our own MOC. As we prepared for our large SARS-CoV-2 patient load, we wanted to have the capability to load balanced hospitals in our county, as well as give the crews a lifeline should they have questions regarding exposure or questions related to transport, no transport. We also saw an opportunity to expand Pulsara into our community health paramedicine program, as well as to our Williamson County and City's Health District, so that they can monitor patients that didn't necessarily need to be admitted to a hospital and who were self-isolating. We could check on them using Pulsara. Sorry, I wasn't clicking my slides here. So again, there's our staff, shout out to them. Here's our Pulsara workflow. So when we introduced Pulsara, we wanted to keep it as simple as possible. So one of the things we did is we kind of streamlined how we did this. And so the setup you see here is the EMS crew activates Pulsara early on. And the reason that we asked them to activate early on is so that that channel is available once they arrive on scene. They receive information from dispatch. We call it a PPE alert. It's essentially an ILI, flu-like illness type patient. They activate that channel. We receive it here at the MOC using some pre-created text messages, so we don't have to type. We can actually answer a call within about 3 seconds. We push out a message that reads, the MOC is on and monitoring. That call is then monitored. We also use CAD to track our crews. We also look at notes in CAD as they're being updated. And then once the crew makes scene, they assess the patient and enter information into that Pulsara app. So the process we have here allows us to push this Pulsara call to the hospital. We can also loop in the Williamson County and City's Health District as needed. And then we also have Dr. Jarvis, our medical director, looped in as a team member as well. So if a crew has some questions regarding whether the patient needs to be transported or not, we can certainly loop Dr. Jarvis in and help the crews make a decision. So far we've used Pulsara pretty effectively. Someone asked a question about rural areas. We do have some pretty rural areas in Williamson County. Pulsara has worked pretty well in those areas as well. We've had some video connectivity issues, but voice has always worked really, really well as well. So again, we're able to use it, and we use it pretty often. What you see on your screen here, this is a communication that I had with one of our medic units, and this was a field crew that had a patient who had been seen at a particular hospital about a week or so ago, had a simple pneumothorax for which she was treated, and then activated 911 because she was having difficulty breathing, and said that she felt like she did when she had her pneumothorax about a week ago, but now was complaining of a cough and a fever as well. So with that information, it was pushed to the crew via CAD. They alerted using Pulsara, made scene in full PPE, assessed the patient, and decided to transport. The patient was requesting a particular hospital that was not considered a COVID receiving facility because they had a NICU within their facility and were trying to minimize exposure. So on the screen, you can see the communication that occurred. They said they were transporting to a particular hospital. I advised them that that hospital was not a COVID receiving facility secondary to the NICU. They again said patient requests that facility, and then used one of their pre-made text messages, as you can see on the screen there. It says request phone call from the MOC. So we created several of these messages for the crews so they don't have to free type, especially with gloved fingers on. They can just have a list of pre-made requests or questions or whatever. In Pulsara, they can just pick from a drop down and hit send, and we get it right away. So this one was please request call from the MOC, and then they qualified that with patient requesting transport to X facility. So in the interim, I sent a text message to one of our EMS liaisons who did state that that facility would accept the patient. However, if the patient did test positive for COVID, they would transfer the patient to a different facility. I did call the crew. I was able to be placed on speakerphone. I did have a communication or a discussion with the patient, gave her the information that she can make an informed decision on her transport and her care. She did, again, continue to request said facility, and the crew did transport her and honor her wishes. So, again, that's just one example of how we've used Pulsara, and it's been very effective. Our medical director, Dr. Jarvis, is very involved in our system. And we contact Dr. Jarvis for all of our online medical control. So inside our scope of care document, there are certain procedures and such that require online medical control, and Dr. Jarvis is who answers those. He is also available for all of our in-field termination and resuscitation. And so Pulsara is being used for that as well. So we have asked our crews for any online medical control to use Pulsara to contact Dr. Jarvis. And the way we have our Pulsara app set up is Dr. Jarvis is a team member that we can loop him in anytime the crew requests him. And again, we have a pre-made text message that says, need Dr. Jarvis for OLMC, online medical control /tour. As soon as we see that come across, we loop Dr. Jarvis in, and he immediately initiates either a video call or a voice call to the crew using Pulsara. And again, the reason we do that is because it's all recorded. We can go back after the fact and look at all the communication that occurred between us, the crew in the hospital, Dr. Jarvis and the crew, and so forth, as well as any images that are taken using the Pulsara app. So what you see on your screen here is an image that was taken using the Pulsara app. It is of the screen showing, the rhythm, heart rate, pulse oxygen, tidal blood pressure. They also took a picture of a 12-lead EKG. And so when they were on scene with this patient, this is a patient who was exhibiting a low-grade fever, did not have a cough, but had been exposed to a known COVID-19 patient. Activated 911, actually a family activated 911 for the patient, and wasn't sure if she needed to be transported to the hospital or not. The crew, in talking with the patient, decided to loop Dr. Jarvis in for some additional support, if you will. And Dr. Jarvis was able to view the 12-lead EKG, the cardiac monitor, and contacted the crew, and they were able to work through it. The patient ultimately refused transport, but we did have the ability to loop Dr. Jarvis in. We did ask the patient if she would be willing to accept the Pulsara patient app, which I believe she did, and then that way we could reach back out to her should we need to. Like I mentioned, we also use Pulsara for all of our field terminations. And so the process that we had before Pulsara was available in our system is our field crew would contact our dispatch communications center. They would then call Dr. Jarvis, and then they would patch the two together. And that was about a 3 to 5 minute process in some cases, and sometimes the calls were dropped or disconnected. So Pulsara has come in. So when a crew is on a cardiac arrest call, when it gets time to reach out to Dr. Jarvis for a termination, they can activate a channel, they enter cardiac arrest into the description, or they use a quick drop-down pick from the pick list on the text messages saying they need Dr. Jarvis for a tour. We loop Dr. Jarvis into the call. He then immediately calls the crew. One of the things that Dr. Jarvis has said is that surveying the scene, getting the crew to pan the scene so he can get an idea of what's going on, helps him make a decision as to whether they need to continue or if everything they've done has been done and it's now a futile arrest. So he does use it extensively. He does like talking with the crews. This is just one of the things that we use in our system, Pulsara. We also use the resource. We use our CAD quite a bit. But we're really liking what we're seeing with Pulsara, and like I've said before, we're looking at expanding it into our community health paramedicine program. They've been very interested in it. We're using it in our Williamson County and Cities Health District to track patients and to reach out to patients, and we have some other plans for it moving forward. But so far, it's been a good change. Just like with anything, it's a new technology. Crews are going to ask questions initially, and because it's new, especially during a pandemic, things can get a little frustrating for the crews. But they've done a really, really good job at adopting it, using it, and we're seeing it used more and more every day. That's all I have.
John, thank you. We had one question from somebody looking at this photo of the plastic covers in the picture and what you're doing to mitigate. Walk through the intubation or advanced airway, some of the training you guys have been doing here.
Sure. So the bag was an idea of one of our field paramedics. Right when the COVID-19 pandemic started hitting our area, one of our crews was on a cardiac arrest call where the patient was just nonstop vomiting. And she sent me a message saying, hey, wouldn't it be nice if there was some kind of bag that we could place over these patients and kind of shield ourselves from the vomit and everything else that was occurring. So I said, hey, that's a good idea, and then she kind of threw some ideas out of how she would like to see this bag designed. And then about 2 days later, Dr. Jarvis came in and said, hey, we need to create a bag that we can use to kind of shield our crews, especially when we were having a hard time getting viral bacterial filters and PPE was kind of scarce. So we reached back out to that medic and said, hey, give us a prototype. And she did. And so what you see there is one of the prototype bags, but essentially it goes down to about the waist of the patient, drapes over the head. And at a certain point in the rest or a certain point in our DSI process, once the patient has been sedated in DSI, we place the bag over them. And then there's, I don't know if you've seen those big plastic gloves that come up to your elbows that are veterinary gloves, or shoulders that are veterinary gloves. They put 2 sets of those into the bag, and they're secured using Gorilla Tape. And the little red tape piece that you see on the left-hand side of your screen, there is a grommet where the viral bacterial filter will snap into that and attach to the ET tube, and then your BVM and everything else on the outside with additional filters. So we intubate using the King Vision underneath the bag. And you can see through the clear plastic, and you can still see your screen. So this is an additional layer of protection for our crews. It's not mandated that they use it. However, we do have it available to them. So viral bacterial filters, and we call it the Brandy bag for Brandy. She was the medic who designed it. So we have the Brandy bag on every truck. We have some on our commander truck. And then Round Rock Fire Department, who is pictured there in the Frog Top gear, were one of our ALS first responder agencies. They also were interested in the bag, so they created some as well, and they have them on their apparatus, I believe, as well.